without contrast, it will be a bit difficult. Okay, so let's have this case. It can come to you as a spotting or antimony case with this appearance. Sometimes they like it to put something like this in the exam. Yeah, it's Joubert syndrome. You like this molar tooth and yes, and appearance, yeah, Joubert syndrome, molar tooth appearance. Most of us like this molar tooth, so it's lovely short case that can come to you and we can put for you some differential, but with this young patient and this appearance, you will consider it as molar. Yes. I think this patient have headache and deterioration of level, no vomiting, upper or, yes, 6 years old. This is the T1. Yes, this is the T1. Yeah. So this T2, you can see that there is multiple lesions of different sites and different signals, but they have like inside every lesion of this, you can see that there is low signal inside and surrounding by high hyper intense signal, right? In the flare, it's more apparent. You can see them clearly now, yes? And it involve everything, even the brainstem, medulla, brainstem, cerebellum, bones, and the different regions of the brain. Yeah, so maybe one of the good differential to put, yeah, it will be neurocysticercosis. Yeah, it have enhancement. So what else could be the differential in your case, in this case? Yeah, it can be infection, whatever, neurocysticercosis, toxoplasmosis, TB, but TB, like you can think about other things because you saw the TB with basal meningitis, or at least there is enhancing of the meninges. Here you cannot see enhancement meninges, right? And also in the diffusion, there is no much restriction, right? There's no high signal in DWI. So, but the contrast in this case, yeah. So you are going with neurocysticercosis, no other suggestion? So this patient, I think he have something. He take like a treatment. Let's have look what he take. And he present with this appearance. Yeah. And you can see that there is something going here more obvious than the others. Yeah. So what is he? You remember that very important in any case that you should to check this the three circles, internal carotid and the basilar. Okay. So what else? Yeah. This is the images. Yeah. So I think you are going to ask me to check the coronal image. There is something going here, especially in this area. Yeah. One of the good differential herpes, okay? Maybe because you see the temporal, maybe, yes. But to be honest, the herpes doesn't appear like this atypical. Typical, it come with temporal unilateral and it have good restriction in diffusion. I don't know if it doesn't have good restriction in diffusion, right? So what else? What do you think else? I think it's a bit difficult, but you can see this meninges here enhancing. Yeah. So this is TB, yeah, right. So this patient have anti-tuberculosis, exactly, TB. And when we saw this enhancing meninges in the second time, maybe we can consider it, yes, exactly, here. Yani, I will just try to, yeah, sure. So here it was really difficult, but maybe you can consider it with the, yeah, low T2 signal and this appearance with high, like a ring appearance, right? That's one of the good things. And this lesion doesn't have any significant marked ring enhancement after contrast. And after treatment, yeah, he take about TB therapy for 4 months, Now he presented with this basal meningitis. That's gave you the impression, but you should comment about this hydrocephalus, to be honest, because if it comes to you as long case and we don't mention this hydrocephalus, it is very, very important that this patient now developed dilatation of the ventricles, and probably there is some obstruction here from the third ventricles level, below the third ventricles level, and the foramen of Monroe, yes. So yeah, it is the same case. Yeah, it is the same case, and this patient is the same case. All these slides now I will share with you after the sessions is available for the neuro. All what we talk about the 4 sessions, every slide is present here, inshallah. So you can go in this list. I will share with you this list, and you will try figure all these cases. I will try also to share with you other lists that have very, very nice cases, inshallah, in the group. Okay. So let's go to the next here and next here. So this Joubert syndrome, it's autosomal recessive, yeah, exactly, autosomal recessive, and sometimes associated with coloboma and retinal dystrophy. This case is not neurocysticercosis. We mentioned neurocysticercosis in the previous session, in the previous lecture, and we show that it have different appearance with 4 stages. So it's not very typical to neurocysticercosis, but one of the differential, sure, it will be one of the differential. Okay, this is the Joubert again, Joubert syndrome. Yes. Yes. Another appearance of Joubert syndrome, yes, molar tooth appearance and the batwing appearance of the fourth ventricle. You can see this appearance of batwing, like, yeah, and this molar tooth appearance, yes. And I think that the connection is a bit, yeah. We have this case before, so let's shift to other. Yeah, so this patient appear with this in the FLAIR image. In T2 image, you have this signal and you have this appearance, and the T1, it is a bit low, yeah. And in T1 with contrast, it doesn't take enhancement. So what it could be? Yes, one of the good differential that you put, yes, retinal detachment can come to you as a short case, yes. Retinal detachment with the appearance, yes. You have other differential. So this is the choroidal detachment. Yes. Yes. So yeah, we mentioned it. Yeah. Okay. So what about this case? This lovely case, because it can, يعني, one of the good differential in the exam, yeah, that he mentioned to you, basal ganglia calcification, and you will find like a list of many things, yes. One of them, if it can come with this appearance and in the cerebellum, you will mention as, yes, FAR disease. So, yeah. Yeah, so this is the list of the differential diagnosis. In the pediatric, you should add for this list torch infection. Yeah. Yeah. I'm just shifting to the presentation better because I see that the connection is very low at Wikipedia.
مش طيب بسرعة بس الصوتية كبيرة ما مش
So I think it's better to go to the slides from the PowerPoint to be more quick. I don't know if it appear or not. This case anyway, yes, it is solved. Can you see the answer in this case? I can just check with you. Yeah. Okay. So this patient, we're talking about something like related to the congenital, right? Yeah. So in this case, can you see the optic nerve? No. Can you see the septum pellucidum? No. So you are talking about septo-optic dysplasia, which is the mildest form of the holobronchocephaly. Yeah. So when you don't find the falx and septum pellucidum, thinking about holobronchocephaly, whatever the type. Okay. This case, yeah, not very good picture, but what did you suspect with this multiple lesions? Yeah. Yeah. So one of the differential will be amyloid, and the other differential, if you don't see it before, what it could be? Multiple cavernous, cavernous hemangioma. But here is amyloid. If you find this elderly patient and this banqueted appearance, and with this some small artery disease, so you are going more that is amyloid angiopathy, and you're sure that you check the history because amyloid is not easy diagnosis. So you should check the history if this case come to you as a long. Differential, sure, that will be hypertensive and other cavernomatous malformation, as we mentioned. So what about this case? Yeah, Dr. Khulud, hereditary hemorrhagic telangiectasia. I think this